Let's start off by talking about what is the Zika virus. The Zika virus is a mosquito-borne flavivirus that is closely related to the dengue, yellow fever, West Nile, and the Japanese encephalitis viruses. The Zika virus is a single-stranded RNA molecule and it attaches to the host cell membrane and is endocytosed, where it undergoes translation and becomes a double-stranded RNA genome. It then releases virions into the intracellular space to infect new host cells. Zika virus is diagnosed with serum testing. So let's talk about modes of transmission. The Zika virus is predominantly transmitted to people through the bite of an infected Aedes species mosquito. The mosquito can become infected if it bites a person that is infected with the virus. The second mode of transmission is mother to child. So if a mother has the Zika virus, she can transfer the virus to her baby through the placenta, which can cause many complications for the infant. The third mode of transmission is sexual contact. The Zika virus can be transmitted through the semen of a male to his partner through any form of sexual contact. Therefore, it's very important for people who are living in the areas affected, as well as those who travel to the areas affected, to use condoms. And the fourth mode of transmission is blood transfusions. Right now, there have been no cases of blood transfusion transmission in the United States. However, there have been several cases in Brazil, and in the French Polynesian outbreak, 2.8% of blood donors tested positive for the Zika virus. As a training healthcare professional, it's very important to know the common signs and symptoms. The first symptom is malaise and a headache. There can also be a rash that occurs on the patient. Another symptom is a mild grade fever. Another symptom can be joint pain and muscle pain and weakness, as well as conjunctivitis. Only 1 in 4 people actually experience symptoms of the Zika virus, and it lasts from 2 to 7 days. The Zika virus incubation period is a few days to a week, and the Zika virus remains in the blood for about a week and remains in the serum for longer. There are a few other complications that come with the Zika virus. The first is Guillain-Barré syndrome, and this is a neurological disease that can lead to paralysis and near total paralysis. And the second is microencephaly, which is talked about a lot in the news and happens when a pregnant woman is infected with Zika and transmits it to the baby. And this can lead to further complications in the baby's health. This image shows you what microencephaly looks like. This map shows the areas where there is active Zika transmission. It is important to know that the cases in the United States have only been travel acquired, and the only places where there is active transmission of Zika is U.S. territories such as the American Samoan territories, Puerto Rico, and the U.S. Virgin Islands. So the final topic that we're going to cover is prevention and treatment. So currently there are no vaccines and no medications for Zika, and please ignore the fact that I misspelled vaccine. So we must just treat the symptoms and prevent the spread of the disease. So first we must prevent mosquito bites. We can do that through bug sprays, wearing long sleeve shirts and long pants, using mosquito nets around bedding, removing any water outside of the house that might be standing or still, and placing screens over doors and windows. We must also keep up to date with the CDC. If you have any travel, please avoid transmission and make sure to use condoms in any sexual contact.